Now, when you start learning medical terminology, it is a bit like a foreign language. All sorts of long words, complicated sounding words, and it doesn't make a lot of sense. But we can soon get to grips with it, and this is the way to do it. Any word is going to have a prefix. A prefix is the part that goes in front of the word. And there's actually not that many of these. So once you've learnt 20, 30, 40 prefixes, it sounds a lot, but it's actually not that many. That'll tell you about what the word is going to be about. It's the prefix, the bit on the front. And then at the end of the word, there's a suffix. And again, there's not that many of these, and that tells you about the word as well. And then very often, but not always, there's a bit in the middle called the root, and that's what the word is about. Now that makes no sense at all the way I've said it just now, so let's go on quickly and look at some examples and try and bring some clarity to this situation. Well, the first prefix we want to look at is hypo, when we see hypo in front of a word. Now hypo, po, is under the bed. Pos are under the bed. That's one way to remember it if that works for you. If not, hypolo, it rhymes, hypolo. So this is derived from the Greek word for under. So whenever we see hypo at the front of a word, it means lower than it should be. Because as you probably know, many parameters in the body are tightly and homeostatically regulated to be in the just right zone, not too high, not too low. And if they go below these physiological limitations into the pathological range, it's called a hypo. So hypo means abnormally low. So prefixes in front, suffixes after, root in the middle. And here we see two words, hyperglycemia and hypoglycemia, written out in black. Now we already know that hypo is low. Anytime we see hyper in front of a word, in other words, anytime hyper is a prefix, that means high, abnormally high. So we have a homeostatically regulated physiological desirable range of a particular parameter. If it's above that into an abnormal situation, it's hyper. Now, if we break the word down here, hyperglycemia. So you can see I've written hyper in red. That's the prefix. It's too high. And in blue at the end of this word, we see emia. A-E-M-I-A. Now that's the English spelling. If you're listening in the US, it doesn't have the A, it's just E-M-I-A. But emia means in the blood. So I don't know quite what gly means yet, but I can see that there's a hyper which is high, and I can see that there's anemia which is in the blood. So something is high in the blood. And actually the gly there, G-L-Y-C, is glucose. Glucose is the only sugar that will be present in the blood. If other sugars are absorbed into the body, the liver converts them into glucose. So when we're talking about blood sugar, we're always talking about blood glucose levels. So hyper, high, gly, glucose, emia, in the blood, hyperglycemia, prefix, red, root in green, suffix in blue. The whole word is hyperglycemia, high levels of sugar in the blood. Abnormally high levels of sugar in the blood. And that might be greater than 7 millimoles of glucose in the blood when a patient has been fasted, or greater than 11.1 millimoles of glucose in any situation would represent a abnormal hyperglycemia. And whenever we find an abnormal situation, we need to try and explain that situation to see what is going on here. Now the next word down, hypoglycemia. Well, we now know that the hypo is the prefix, so that means abnormally low. We see the root of the word, which is gly, and we know that's to do with the glucose. And then we see the emia on the end, which means in the blood. So that is low blood glucose. And generally speaking, we don't want blood glucose levels to go below 4 millimoles of glucose. So anything lower than 4 we would count as a hypoglycemia. We have a saying in diabetic control, 4 is the floor. We don't want things to go lower than a blood sugar level of 4 millimoles. That would be a hypoglycemia. That could be caused by too much insulin, for example. And we would need to treat that by giving perhaps some sugary drink or something to eat if the patient was alive and well, alive and conscious rather. And if the patient was unconscious, we might need to give them injections of glucagon or intravenous dextrose, for example, to bring the blood sugar levels up back into a physiological range. So hypothermia. Hypo means low. Thermia is to do with heat or body temperature. So hypothermia would be an abnormally low body temperature. Now body temperature does vary a bit throughout the day, and it's often lower overnight, for example. So there are some variabilities in it, but we would normally describe a hypothermia as any time the body temperature is less than 35 degrees centigrade. Although you'd probably be feeling pretty cold when your body temperature was 35.8 degrees centigrade or something like that. But hypothermia will call anything less than 35 degrees centigrade. In that case, we would want to take steps to warm the patient back up again to get them back into the physiological range for temperature. Hyper means high, thermia means body temperature, so hyperthermia is an abnormally high body temperature. Now, if people are unwell, if they have bacterial or viral infections, they can develop what we call a pyrexia or a fever. They become febrile. And in that case, the body temperature will be increased, so technically that is a hyperthermia. But normally we use the term hyperthermia to talk about an abnormally high body temperature when the set point of the hypothalamus is set to normal levels. In other words, the patient doesn't have particular tissue damage, doesn't have a viral or bacterial infection which is inducing a higher body temperature. So we'll call a hyperthermia an increase in body temperature when the set point of the hypothalamus is normal. And we can define the level at where hyperthermia starts differently. Some people say anything higher than 38.3 degrees centigrade. But certainly if someone's temperature is up to 39 degrees centigrade, they would be hyperthermic. And I would be getting concerned anything above 39 really. And by the time someone's temperature got to 40, I would be very concerned and would want to bring it down as a matter of urgency because they could be developing heat stroke. And these are life-threatening conditions. In fact, everything we've mentioned on this page is a life-threatening condition. Hyperglycemia can cause long-term health problems, severe health problems. Hypoglycemia can be life-threatening over just a few minutes, a rapidly life-threatening condition. Hypothermia is life-threatening and hyperthermia is life-threatening. There's been a few tragic cases of soldiers on exercise who've developed hyperthermia. Exercising, walking up mountains, carrying packs and weapons, often in full combats, so the sweat doesn't dry. You see, the sweat has to dry or the body temperature can start to rise. So beware of the ambushes from hypos and hypers, and let's correct them and get them back down to physiological ranges before they damage the people under our care. Now, there's a word here I haven't come across before. Hypoalbuminemia. Well, hypo actually means low, and emia means in the blood. So this must be low levels of albumin in the blood. And I do remember that albumin is one of the plasma proteins. In fact, it's the most ubiquitous plasma protein produced in the liver from amino acids, and it's the one that gives the blood a lot of its osmolarity, a lot of its oncotic pressure to suck fluid back in from the capillaries. So hypoalbuminemia must mean low levels of albumin in the blood. And of course, this is exactly what it does mean. And if patients are hypoalbuminemic, because they're not able to osmotically suck back in the tissue fluids from the interstitial spaces back into the blood, then these patients can often become swollen with edema, they can accumulate tissue fluid. And you might have seen these awful pictures of children with big blown up tummies when they've got protein deficiency. This is because they're hypoalbuminemic and they can't suck the fluid back in from the tissue spaces into the intravascular compartment, and therefore become edematous because of the hypoalbuminemia. The treatment, of course, is to restore the amounts of protein in the blood, and in malnutrition we can simply do that by giving them protein to eat. Hypothyroidism. Hypo, low. Now when you see ism on the end of a word, ISM, that means a condition of. And thyroid is the thyroid gland in the neck that produces the thyroid hormones, the T3 and the T4. So hypothyroidism is low thyroid condition of, literally. So a condition where there are low levels of activity in the thyroid gland, giving rise to low levels of thyroid hormone in the blood. And this condition of, we know it's a condition of because of the ism, a condition of low thyroid. And we can treat this by giving artificial thyroid tablets. That's usually fairly straightforward to treat as long as it's identified. And the hypothyroidism would normally be diagnosed by analysing the amount of thyroid stimulating hormone or the amount of thyroid hormones in the blood. So the converse of hypothyroidism is hyperthyroidism. Hyper, high, thyroid gland, ism, a condition of, where there are high levels of thyroid activity for whatever reason. For example, this could be caused by Graves' disease, which is an autoimmune disease causing overstimulation of the thyroid gland. Again, we can recognise this through the clinical features that we might associate with the condition, and we can diagnose it definitively using various blood tests. Now, when we are talking about hypo and hyper, sometimes we say it quickly and it's not obvious which one we're saying. So we have to be clear, it's hypothyroidism, hyperthyroidism. Say the word clearly, because if we say it quickly it can sound much the same and can get a bit confused. Now here we see tension used twice as a suffix on the end of a word. And tension means pressure. So hypertension literally means high pressure. Now we would actually need to specify where the high pressure is. So for example, someone might have pulmonary arterial hypertension, which would be high pressures in the pulmonary artery. But if we use the term hypertension in an unqualified sense, it usually means increased blood pressure in the systemic circulation. So when you take your blood pressure, you might find your systolic pressure is 120 millimeters of mercury. You might find your diastolic pressure is 80 millimeters of mercury, maybe a little less if you're young and fit. And if it was high, that would be hypertension. Now, where hypertension begins, we can argue about. Sometimes we might want to be careful with patients if their blood pressure is over 140 over 90. But hypertension means an abnormally high blood pressure, unless it's qualified by some other specific location. Hypotension, low pressure. And again, unless we actually specify a particular location, we're normally talking about the systemic arterial circulation when we use the term hypotension. So if a patient is hypotensive, we need to monitor that situation because they might be going into shock, for example. Or if you're lying down, especially on a warm day, then you get up all of a sudden, you might feel dizzy for a second or two. That's a postural hypotension. The blood pressure is a little low while the autonomic nervous system adapts to the new standing position where the blood pressure needs to be a little higher. Some people have quite severe postural hypotension and they have to sit up really slowly to let their blood pressure adjust. But hypotension is a lower blood pressure than we would expect. And of course, if someone's very hypotensive, dangerous situation because, as we've said, they could be becoming shocked. And if the blood pressure is so low that the tissues of the body are not adequately perfused, we would define that as a clinical shock. Now you're probably getting the hang of the highs and lows now. Just a few more examples to finish off. High cholesterolemia, high levels of cholesterol in the blood, possibly contributing towards the process of atherosclerosis development, which we don't want. So we might give statins to bring that down, and we might give patients advice on their lifestyle to help lower their cholesterol. So hypercholesterolemia, really quite simple. Hyper the prefix, cholesterol the root, emia the suffix, high levels of cholesterol in the blood. Well, here's another long word, hypogammaglobulinemia. But if we break it down, it's quite easy. Hypo, low, emia in the blood. So there are low levels of gamma globulin in the blood. And gamma globulins are mostly the immunoglobulins, the immune proteins. So if someone had hypogammaglobulinemia, they would be predisposed to developing infections. If you work in healthcare, very often we're giving hypodermic injections with a hypodermic needle. Hypo means low or below. Dermic is the dermis. So a hypodermic needle is one to penetrate below the dermis. So that could be for subcutaneous injections, intramuscular injections, or intravenous injections. They're all hypodermic because they go below the dermis. Or we could use a hypodermic needle to penetrate through the dermis into a vein to get a blood sample. We're still using a hypodermic needle below the dermis. Hyper, high, activity, just the English word. So hyperactivity is where there is an increased amount of activity. And if this is increased to a pathological or abnormal situation, that could be called a hyperactivity disorder. So what we've done here is we've taken words that can initially look a little bit complicated, divided them into prefixes, suffixes, often with a root in the middle. And if we look at it in those terms, once we've built up a little bit of a vocabulary, we can work out what the words mean. So anytime you see a new word, if you don't understand it, don't let it go past you, just maybe quickly write it down. Then later on check on the prefix, the root and the suffix, and you should come to understand the meaning of a very wide vocabulary of medical terminology relatively quickly.